Welcome to Aging Insights. I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. Aging Insights is produced by the New Jersey Foundation for Aging to provide information and resources to boomers, seniors, and caregivers. Today's topic is elder economics. We have two guests, but first I thought we would share some information about the New Jersey Foundation for Aging with you. This video that you will see was prepared for our 10th anniversary in 2008. It will hopefully give you a sense of our mission and some of the work that we have concentrated on.
The New Jersey Foundation for Aging is seriously concerned about providing for the independence, the well-being, and maximizing the options of older persons. We're looking at funding programs that do not necessarily depend upon government funding for their existence. There are services that are needed that if it were not for the foundation, they may not be readily available. It is extremely important for the elderly citizens of this state to be able to function within the community with a maximum amount of independence and a maximum amount of support. I think the Reflection program in Chatham is a perfect example of how different resources were brought together. Additional dollars are made available to them subsequent to our award. It's now going to make a meaningful difference within that community.
The program brings together a group of women with a professional facilitator. At these meetings, the women discuss really the day-to-day activities of their lives. They discuss the good things that they're facing. They discuss the difficulties.
We have gone through some difficult times together. We have helped each other.
For some people, in some of my groups, this is the only time they have someplace to go for some people. And that's the day they make sure they get up and, get there.
We find that there are very few government programs that offer day-to-day support that we're offering, particularly on a local level.
I think that Reflections is a marvelous idea and has been very successful.
Without funding from the New Jersey Foundation for Aging, without funding from our other sources, we wouldn't be able to provide the programs that we do provide.
Over the last 10 years, we have funded more than 33 projects across the state. Our emphasis is on innovative programs that enable seniors to live independently in their communities. SWAT, Senior Wellness Action Teams, is a fitness and wellness program in Essex County that does just that.
SWAT delivers health and wellness promotion programs to the senior communities within Newark and the various surrounding cities, including Irvington, Hillside, and several other communities. CC's exercise program we found to be a major part of SWAT. And we sought funding, and the New Jersey Foundation for Aging's funding enabled us to bring her program into many of the sites that we currently serve. And we are up from, when we originally started, from 11 sites, we are up to 40 sites.
And they have all types of abilities, and CC works so well with them. She just allows them to do what they're able to do. And then we usually have some jokes as we do all this, and we laugh, so we socialize as we're doing it. And it's wonderful to know that she's teaching us things to do that are within our abilities to do it.
Empowering people to make the most of their environment and the community is paramount to our work. This means recognizing the obstacles that reduce access to services. In some cases, this is a transportation issue or a language and cultural understanding. America, a New Home, is a program that addresses access by reducing cultural barriers.
Over the past few decades, Plainsboro has become an increasingly culturally diverse community with a significant population of foreign-born senior citizens. It became clear that these seniors lacked opportunities to adjust to life in America due to a language barrier, unfamiliarity with our culture, and a general reluctance to establish their independence in the community, unlike their adult children who gain these skills through interactions at their jobs. Fortunately, thanks to the funding support of the New Jersey Foundation for Aging and our corporate sponsor, Bristol Myers Squibb, back in 2004, we were able to initiate a program that provides these seniors with opportunities for socialization, venues for sharing their cultures through community events such as Traditions, our annual showcase of celebrations, holidays, and festivals from around the world, English language instruction, and practical skills for everyday living that are gained through discussion groups that examine various aspects of American lifestyle, such as the nature of our interpersonal relationships, our social interactions, and the challenges of dealing with children or grandchildren who are first-generation Americans. Over the course of the past 4 years, these activities have helped hundreds of foreign-born senior residents of Plainsboro build self-esteem and confidence, establish friendships in a comfortable setting, and increase their connection with their community.
The Community Grant Program addresses needs relevant to local communities. The Foundation has funded programs in 17 counties in New Jersey. In Cape May, we have sponsored a project that provides access to health services by bringing preventive screening to many rural communities through the Parish Nurse Program.
I would say that we have done slightly more than 2,200 screenings in the years between 2005 through the present. And of those 2,200, about 25% have shown the need for further testing and some preventative services or seeing a doctor or whatever. So hopefully we are helping people to reduce their risk for having a fracture as they grow older and to learn something to prevent having a fracture. This was all made possible through our grant support from New Jersey Foundation of Aging.
We are proud to be able to enhance the lives of seniors and provide assistance to their caregivers through our Community Grant Program. However, we also take a broad approach to our mission and look at the systemic causes and solutions to the challenges facing New Jersey seniors. With this in mind, we have brought tough issues to light that require attention. Examples include the importance of retaining and retraining older workers, supporting family caregivers, and making the road safer for all by assessing and enhancing older driver skills and improving road design.
What we want to see as a foundation is for individuals to have options available to them that might not otherwise be available if it were not for the foundation. We want to increase opportunities, we want to increase options, we want to maximize independence, and we want to make sure that our older citizens have a quality of life that's worthy of their existence.
To learn more about our work, please visit www.NewJerseyFoundationForAging.org or call us at 609-421-0206. Aging is everyone's business.
Today we are joined by Melissa Chalker, who has a master's in social work and is program manager with us at the New Jersey Foundation for Aging. And we're also joined with Lisa Pitts, who also has a master's in social work and is director of the advocacy and outreach for the New Jersey Anti-Hunger Coalition. As you can see from the brief video, the foundation has focused on a variety of policy issues, and in 2009 we released the Elder Index. Melissa was very involved in the development of the report, and Melissa is here to share with you some of the focus of the report and some of our findings. Melissa, please give us an idea of what the report focused on.
Well, the Elder Index was to give us an idea of the cost of living for seniors in New Jersey and features data from counties, all 21 counties in New Jersey, and really was to give us an idea of the cost of living for singles and couples in New Jersey, both with a mortgage and without a mortgage, as well as seniors who are living in a one-bedroom apartment. The average cost for a single renter in New Jersey in a one-bedroom apartment for the year is $26,656.
Could you say that number again?
$26,656 annually is what the estimated cost is for a senior in New Jersey who's renting a one-bedroom apartment. Wow. Now this includes the components of housing, food, transportation, health care, and a miscellaneous category as well. And these costs are modest costs, and we found that really housing is the highest expense for seniors next to their health care. And what really happens is that couples are not really spending that much more than their single counterparts in the areas of food or transportation, but where they are spending more is in health care. Being that there's no family plan on Medicare, there is no economy of scale as there would be with things such as food costs, where an elder couple is not spending double in the grocery store on their food, but they are actually spending double with their Medicare premiums. And again, the costs are modest, so these are not vacations or taking your grandkids to the movies or going out for a lobster dinner. They're just the basic costs for those components.
Yeah, and I know that we also looked at what the average Social Security is for a woman or a gentleman in New Jersey.
Yes, when you look at that figure of $26,656 that a single renter needs compared to what their income might be, a single woman in New Jersey who's relying on their Social Security is receiving really almost, just under $13,000 annually, where a man is receiving a little over $15,000 annually. And even those who are receiving a retirement income are still falling short of that $26,000, with the median retirement income for a gentleman being just over $19,000 a year, and for a woman being just over $15,000 a year. So they're still falling short of that figure that we've showed for the costs.
And we need to keep in mind that these are averages. There are some people that are only getting $700 a month in Social Security, which would mean their total would be $7,200 or something like that. So it's, the average might still be higher than some people are getting.
Absolutely.
I know we had some key findings, and
We did. We found that 1 in 5 seniors in New Jersey is living solely on their Social Security, which then brings to light what you just said about those that are relying on a small amount. As well, we found that 25% of our seniors are renters, so those are the folks that are really needing that $26,656 figure that we've been talking about. And then about 22% of our seniors in New Jersey are still paying off a mortgage, and those folks are really faced with a cost that's double what their counterparts who have a home with a mortgage paid off are paying.
yeah, it really brings out the point of what the gap is and how some seniors are struggling, and the reality of having a mortgage when you're over 65.
Absolutely.
I think it's a key piece of information for people that are planning their retirement. For those of us that are looking ahead, there are some real learning lessons in this report. But what's also interesting is to look at what can close the gap. And I know we've talked about affordable housing.
Yes, in the report there's also some policy looking at what programs will really help a senior that's facing that gap to close the gap. And we really did find that affordable housing made the most impact, the most difference for seniors who were facing a wide gap. However, waiting lists are long and budget cuts have really drawn back that program, so not as many people can take advantage of it. But that doesn't mean that there aren't other programs that can help to lessen their hurt and to really help to close that gap. Programs such as pharmaceutical assistance, where people get help with their prescription drugs, as well as many of the nutrition programs that are offered.
And that's one of the reasons why Lisa's here today. We wanted to talk about some of the nutritional programs and SNAP in particular. SNAP, some of our viewers may have seen in some of the material they're getting for their PAAD renewal, and PAAD is pharmaceutical assistance for the aging and disabled. And we understand that renewals go out on anniversary dates, and that in fact there's now a statement on the form that indicates do they want to opt in to get some information about SNAP, which is the new name for food stamps. And it can be a very important help, and that's why Lisa is here today to talk with us about senior outreach and some of the benefits of SNAP. So, Lisa, tell us more about SNAP, and actually, why don't you tell us about the Anti-Hunger Coalition first?
Okay. The New Jersey Anti-Hunger Coalition is a statewide organization, and our mission really is to end hunger in New Jersey. We try to do that through education and advocacy. A big emphasis on our work is really in trying to improve access to federal feeding programs like food stamps, SNAP, and some other programs, child nutrition programs, etc.
And SNAP in particular, I mean, now, as you say, it's the new name for food stamps. I mean,
Right.
has it changed much? I mean, how does one become eligible for SNAP?
In order to be eligible for food stamps, you have to have an income of at or below 185% of the federal poverty level, which for a one-person household, I believe, is a little over $20,000. That was just increased in New Jersey. It used to be 130% of the federal poverty level, so it's a big difference between 130 and 185, and it's made a lot more people eligible that were not previously eligible.
And there are a few things that when they apply that they should either know or bring with them, I mean, in terms of medical expenses and different things?
They've made it a lot easier to apply. First of all, you can apply online. You can submit your application online. You can go to New Jersey Helps and you can get the application there. You don't ever have to go into the food stamp office in many cases. This is brand new and a big help to seniors. If you submit the application online or someone can help you to do that, then you will get a letter telling you when you'll have a telephone interview. At that time, you'll be interviewed over the phone. And then you have to send in some verification documents, proof of income, identifications.
Copies.
Copies, yes, not originals. And all that will be included in the letter that people get after they submit the application online.
How does someone know that the person calling them is really from the Board of Social Services or the SNAP agency?
Well, they would only call them after the application had been submitted.
Okay.
So they would be able to verify that over the telephone and verify themselves as an employee of the County Board of Social Services. That is where all the food stamp offices are located. Each county has their own office in each of the 21 counties.
Which is nice that it really is a localized program. And then if someone is eligible and they receive an award, how does it work? I mean, people may have a perception of when they were actually handed vouchers or checks.
Right.
And how does it work now?
Right. As you said, food stamps is no longer stamps or coupons as it used to be.
That's right.
It is now actually what they call an EBT card, and it basically works like a debit card, where you go to the grocery store, you swipe your card, your benefits are automatically put onto your card at the beginning of each month. You go to the grocery store, you swipe your card, and you make your purchases. So they've made it a lot easier for people to use. The EBT card in some cases, because the program is administered individually on the county level, some counties are not necessarily mailing the EBT cards. Some will mail the EBT cards. That might be the one time that someone has to go into the office to actually pick up the card, and they have to code it like you would have to enter a PIN number on a debit card. It works the exact same way.
And what does EBT stand for? I don't know if you said it.
Electronic Benefits Transfer.
Transfer, okay. And it looks just like a credit card.
It looks just like a credit card or a debit card.
And what can you buy with SNAP or these days?
Any and all kinds of food products. The only thing that you can't use your food stamp or your SNAP benefits to purchase are personal care items, toiletries, household items like
detergent. No,
you can't use it for detergent or paper towels or toilet paper or anything. But any kind of food item you can use it for.
Oh, well, that's really good to know. And is it accepted everywhere?
For the most part, major grocery stores do. There may be some more local bodegas and things that do not, but most do.
Well, I think that's really important for people to know, and you know, the idea that there's this benefit out there. Now, there's a minimum, but there's also the minimum is $16?
The minimum benefit amount would be $16 a month. And what I always say to people, you know, when they say, well, why would I bother? It's not very much money, is, first of all, it can increase if your circumstances change. All you have to do is report any change in income or your circumstances, and your benefits can go up. Oftentimes for seniors, they can take a lot of medical deductions. So if you're paying a lot of out-of-pocket medical expenses, your food stamp benefit should increase if you can prove those expenses. And that would be prescription medications, you know, any sort of secondary insurance, anything like that. Glasses, dentures, dental care, anything like that could be deductible and could increase that benefit amount. The other thing I say to people is $16, if you don't use it all in 1 month, the benefits will carry over to the next month. And most people do get more than 16, but that is the minimum benefit.
Yeah, I think it's interesting to know that I've heard that the average can be $76 a month, or even as high as $170, but obviously that would be somebody who's presenting a great deal of need, or as you said, those deductions. It makes sense to keep track of those expenses if you feel you're eligible, because that documentation will obviously help. So I think that's good. And how long does the benefit continue?
The benefit is ongoing as long as someone needs it. They have to recertify or do a redetermination. That was also just increased in the state of New Jersey. For seniors, it is now every 2 years. It used to be every year. But they will get a form in the mail every 6 months that basically, if their circumstances haven't changed at all they have to do is just check off saying that not everything is the same, sign it, and return it back to the food stamp office by mail. And then they have to physically do the redetermination every 2 years.
Well, I think this is really very helpful information. I know the Anti-Hunger Coalition is also doing some senior outreach, and maybe you could just touch on that a little bit for our viewers.
Our organization, along with the 6 regional food banks in the state of New Jersey, have been engaged in food stamp outreach targeted directly to seniors and the broader community. Our work is really targeted specifically to seniors, going to senior housing facilities, senior centers, with laptops, and helping seniors to fill out the online food stamp application, helping them get verification documents together, working with the local county boards of social services to troubleshoot any issues or barriers that come up, so that at the end of the process they end up with an EBT card with the maximum amount of benefits that they can possibly get.
That's great. And how many people do you think have really been able to been touched by this and perhaps be enrolled? Do you have a sense of that?
We are tracking all the information statewide. It's a relatively new initiative, so at this point I would say there's already been statewide several hundred people who've been assisted with the application.
I think that's very wonderful. I think it's important that the Anti-Hunger Coalition recognizes not only child nutrition but also families and seniors. I think it's an important opportunity for us to partner together, and so I think it's very nice. And obviously a lot is coming to the County Board of Social Services. I mean, it's a lot of work, and you know, it's helpful that they're there and working with the seniors as well. So just to recap, so to find out how to apply, one can go to the 21 county offices.
People can go into their county office. They can find out where their county office is by going to newjersey.gov/human services. Again, if people want to access the application online or have someone help them access the application online, it's newjerseyhelps.org. They'll be able to submit it, and once they send the application electronically, the county food stamp office will be in touch with them in terms of when they can do a telephone interview and what the next steps in the process are.
And then, as you said, some of this work is happening at the 6 food banks across the state.
Food banks have outreach workers as well who are going out into the community.
The pilot sounds really interesting, and I'm sure you've seen a lot. I mean, can you give us a sense of some of the experiences you've had in the field?
Sure. Recently we did some outreach at a senior housing unit in Union County. And people came down to the common room, and we had our laptops, and we helped them fill out the online application and helped them with follow-up, as I mentioned before. One woman in particular who never applied for food stamps before, didn't think she'd be eligible, didn't even know where to begin the process. She had a very small retirement, was also receiving Social Security, and she ended up getting $200 a month in food stamp benefits.
Wow, that's a big boost when you think about how tight her resources were. So, so how did the rest of that process go? She got the EBT card?
She got the EBT card. As a matter of fact, when you apply for food stamps, your benefits are retroactive to the day that you actually submitted that application. So it took a few months for them to process her application because the county offices are backlogged with applications. So people should be patient. It may take some time. It may take 2 months, maybe even a little bit longer. But at the end of the day, when she ended up with the benefit card, she had the retro benefits and had over $500 on her card that she could use over the course of however long to purchase things that she needed that she was unable to get before. And she was very happy, very emotional about it. She had really been skimping on meals. She had really been compromising her nutrition. And these benefits now will enable her to be able to get proper nutrition and purchase food.
Yeah, and that's pretty much what we're trying to point out to people, is that there are benefit programs out there. So thank you. I really appreciate you sharing that story. Yeah, we really have seen a rise of seniors utilizing food banks, and I think it's important to realize that the food banks are there, but SNAP and these opportunities are really there throughout the month, and that if the benefits are not sufficient, then it's appropriate to go to the food bank. I'd hate to have someone say, well, I don't need food stamps because I go to my local food bank. It's really a combination of benefits that helps people stretch their resources and, as Melissa said, kind of close the gap. And this is just, I think, one of the many things that the Elder Index pointed out to us, that there are resources that sometimes are underutilized by seniors, and we just want to get the word out. And it's important for their caregivers and those of us, I think, that are trying to stay on top of these issues as we look ahead and plan our financial planning and make resources available that we might need. So I really appreciate you both coming today, and I think that we will be learning more as we move ahead in terms of what we can do in terms of making more resources available to seniors. So I appreciate both of you being here, and hopefully, Lisa, we will hear more about the pilot as it moves on and gets a greater outreach into the state. So thank you.
Thank you.
We appreciate you joining us for this edition of Aging Insights. We're pleased to have the sponsorship of the Silver Century Foundation to support Aging Insights. That foundation advocates for planning for the second half of life and inspires everyone to live long, healthy, and empowered lives. Until next time, remember, take care, and aging is everyone's business.